Human anatomy is the study of the body's structure. It is a core subject for physiotherapy students. Understanding how the body is put together is crucial for physiotherapists. It helps them diagnose and treat patients. Physiotherapists need to know how bones, muscles, and joints work together. This knowledge is essential for assessing movement. It allows them to identify any abnormalities or restrictions. By understanding anatomy, physiotherapists can design effective treatment plans. Injury prevention is another key area where anatomy is vital. Knowing how the body moves helps physiotherapists advise on proper techniques. They can guide patients in exercises and activities. This guidance helps prevent injuries. Finally, a strong grasp of anatomical terminology is essential for communication. Physiotherapists need to communicate with doctors and other healthcare professionals. Clear communication ensures everyone is on the same page. This is vital for coordinated patient care. Several anatomical systems are particularly relevant to physiotherapy. The skeletal system, made up of bones and joints, provides the body's framework. Understanding the skeletal system is crucial for analyzing joint movement and stability. The muscular system is responsible for movement. Physiotherapists need to know the location, action, and function of different muscles. This knowledge is applied in muscle testing, exercise prescription, and various treatment modalities. The nervous system controls and coordinates body functions. It includes the brain, spinal cord, and nerves. Physiotherapists must understand how the nervous system impacts movement and sensation. This is essential for treating neurological conditions. The cardiovascular and respiratory systems are also important. The cardiovascular system, comprising the heart and blood vessels, delivers oxygen to tissues. The respiratory system, including the lungs, is responsible for oxygen intake. Understanding these systems is crucial for managing patients with cardiorespiratory conditions. There are various methods for learning human anatomy. Dissection, involving the examination of cadavers, provides a hands-on understanding of the human body. While dissection is a traditional method, it is not always accessible. Models and anatomical charts are valuable tools. These resources offer a visual representation of the body's structures. They are particularly useful for understanding spatial relationships between different organs. Clinical case studies offer real-world applications of anatomy. By studying actual patient cases, students can apply their knowledge to diagnose and develop treatment plans. Case studies bridge the gap between theoretical knowledge and practical application. Technology plays an increasingly important role in anatomy education. Virtual dissection tables and three-dimensional anatomy software provide interactive and detailed visualizations. These tools allow students to explore the human body in a virtual environment. A sound understanding of anatomy is fundamental to physiotherapy practice. It forms the basis for assessing patients, diagnosing conditions, and developing treatment plans. Whether it's designing an exercise program or performing manual therapy, anatomical knowledge guides every step. Physiotherapists use their knowledge of anatomy to identify the root cause of a patient's pain or dysfunction. For example, they can pinpoint a specific muscle weakness contributing to poor posture. This targeted approach enables more effective treatment. When designing rehabilitation protocols, physiotherapists rely on their anatomical knowledge. They consider muscle actions, joint ranges of motion, and biomechanics. This ensures that exercises are tailored to the patient's specific needs and limitations. In essence, human anatomy is the bedrock of physiotherapy. It equips physiotherapists with the knowledge to understand, assess, and treat the human body. By continually developing their anatomical knowledge, physiotherapists can provide the best possible care for their patients.